Uganda has nearly half its population under 15 years and more than 3/4 below 30, presenting an opportunity for a demographic dividend, especially if issues like sexual and reproductive health are addressed. Sexual and reproductive health is key to this, as access to accurate information and services helps reduce teenage pregnancies, early marriages, and school dropouts, challenges that continue to affect many young people, mostly girls, across the country.
See young people coming to health facilities with STIs, different types of STIs, especially the girls. We see a rising challenge of new infections of HIV. We are also seeing many young people reporting to our health facilities with the abortion complications.
The State Minister for Youth and Children Affairs, Balaam Barugahara, emphasizes that youth inclusion in policy decision-making is critical to driving awareness and meaningful change.
We need to hear from their voices to understand what they need, to understand what works for them, because the world we live in now is a dynamic world. So sitting with young people is key, and ministries coming together is quite key.
Officials from the Ministry of Education also say the data highlights a problem, but through joint and collaborative efforts among relevant stakeholders, government is working to translate policy into action.
Much as the data is not good, I know that there are ongoing efforts by so many players, including those of us in this room. The previous speakers have mentioned multi-sectoral efforts. As education, we are doing our part for those young people in school. Gender out of school. Ministry of Health is an intersection. They find us everywhere. The religious leaders are doing their part. We only have to call for all those stakeholders to play more of their part.
Joseph Katerega further stresses that concerted effort is needed towards awareness, particularly in rural areas.
We have lack of awareness, whereby when you get away 30 kilometers away from Kampala in each direction, the next areas you reach are villages. Most people actually outside there, they have like lack of information dissemination. When people move in ignorance, in most cases, they do wrong things and they think they're right.
Pauline Ongoyet, UBC News.